Do you ever get slammed by one small thing and then the rest of your day falls apart? Maybe someone cuts you off in traffic. Maybe you get a curt text from someone in your past. Suddenly your chest is tight, your thoughts are racing, you cannot focus on work or on dinner. If that sounds familiar, you might be dealing with low vagal tone. Today, I am breaking a set of vagus nerve reset routines. I am testing fast reset techniques that are meant to give you immediate relief and long-term routines that are meant to build lasting calm. I'm going to show how I tested each routine, what I felt right away, and what I think is worth doing regularly. Quick safety note is that several of the exercises deliberately change blood pressure. If you have high blood pressure, heart disease, glaucoma, or any cardiovascular concerns, check with your doctor before trying them. The vagus nerve is the main communication line between your brain and many organs. It helps control heart rate, digestion, breathing, and inflammation. When vagal tone is higher, your system is better at returning to calm after stress. When vagal tone is lower, one upsetting event is more likely to ruin your whole day. The routines I tested are grouped into two buckets. Fast resets are the things you can do in 1 to 2 minutes when you feel your heart racing and your thoughts spinning. Long-term routines are daily practices you can use to slowly build resilience so the same upset does not knock you off your feet. Here's how I tested everything. For each routine, I rated my anxiety on a 0 to 10 scale, where 0 is totally calm and 10 is completely overwhelmed. I recorded a before score, did the practice for a short, practical duration, and then recorded an after score. For long-term routines, I also tried a 2-week mini-experiment where I practiced the routine daily and tracked how my baseline anxiety changed. Everything is subjective, but that is also the point. These are practical tools you can try on your own. Let us start with the fast resets. Fast reset 1 is the cold neck compress. I went to the freezer, grabbed a small soft ice pack, wrapped it in a thin towel, and pressed it gently to the sides of my neck for 15 seconds on each side. Before doing it, my anxiety was 7 out of 10. After one full cycle, my anxiety dropped to 5 out of 10. The sensation is immediate. You feel a jolt of cool, your breathing tightens for a second, and then your heart rate slows. That is the diving reflex in action. The effect is reliable and fast, but it lasts only a few minutes for me. If you like a quick physiological reset, this is a good tool to keep in your freezer. Fast reset 2 is the modified Valsalva. How I did it is that I sat back, inhaled a normal breath, pinched my nose, closed my mouth, and pushed gently as if I was trying to exhale against a closed airway for 15 seconds. Then I relaxed and elevated my legs, or at least lay back for 20 to 30 seconds while breathing slowly through my nose. Before the Valsalva, my anxiety was 7. After one round, it dipped to 4.5. This is a strong drop. You feel pressure build and then release, and your heart rate tends to slow on the release. This method is used in emergency settings to slow runaway heartbeats, so it is powerful. Use caution if you have heart problems or blood pressure issues and check with a clinician first. Fast Reset 3 is the 4-breath box. How I did it is that I used a structured 4-count method where I inhaled for 4 seconds, held for 4 seconds, exhaled for 4 seconds, and waited for 4 seconds before repeating, for 4 full cycles. I started at a 7, and after those 4 cycles, I was at a 3.5. This is basically breath control that gives you immediate parasympathetic activation. It's simple, portable, and low risk. If you feel dizzy, stop and breathe normally. Fast Reset 4 is humming. How I did it is that I sat up straight and hummed on the exhale for 3 rounds of 30 seconds each. I felt the vibration in my throat and my chest, and my anxiety went from 7 to 6. Humming is less dramatic than the other fast resets, but it is pleasant, and when you combine it with slow breathing, it's stronger. Those are the fast resets. I rank them by immediate impact like this. Number 1 is the modified Valsalva. Number 2 is the cold neck compress. Number 3 is the 4-breath box. Number 4 is humming. The Valsalva is the most dramatic, but it is the one that you should use cautiously. The cold compress is the most practical for many people, and the 4-breath box is the most repeatable anywhere. Humming is a useful add-on. Now let us move on to the long-term routines. These are the practices that do not necessarily wipe away anxiety in 60 seconds, but that over weeks can increase your baseline vagal tone so stress does not stick to you as long. Long-term routine 1 is daily paced breathing. How I did it is I practiced slow breathing for 10 minutes each morning for 2 weeks. The cadence I used was inhale for 5 seconds and exhale for 7 seconds. Before the 2-week trial, my baseline daily anxiety averaged around 5.5 on a typical morning. After 2 weeks, my average baseline was around 4. The change is modest but noticeable. Slow breathing done consistently increases heart rate variability and makes the parasympathetic system easier to access when you need it. This is the single most approachable long-term routine. Long-term routine 2 is regular cold exposure. How I did it is I finished my shower with 30 to 60 seconds of cold water 3 times per week for 2 weeks. The first week, my evening anxiety dropped by a small amount. By the end of 2 weeks, I noticed an improved sense of resilience on days when something stressful happened. Cold exposure is not for everyone, and in some people, full-body cold can be stimulating in a way that increases adrenaline. Localized neck cold is safer for quick resets. If you try regular cold exposure, build up slowly. Long-term routine 3 is daily singing or vocal practice. How I did it is I sang for 5 minutes each day for 2 weeks. That 5 minutes included sustained vowel sounds and some upbeat songs. My baseline mood rose slightly and I felt calmer in small social stressors. Singing combines breath control, vocal cord vibration, and positive affect. Over time, it can increase social connectedness and resilience. Long-term routine 4 is a short yoga or mobility routine focused on breath and posture. How I did it is I practiced a 10-minute sequence each evening that emphasized chest opening and slow diaphragmatic breathing. After 2 weeks, I felt lighter and my shoulders were less tense. The change in baseline anxiety was small, but real. Better posture helps the diaphragm work and makes breathing easier, which supports vagal tone. Here's how I ranked long-term routines for lasting calm. Number 1 is daily paced breathing. Number 2 is regular cold exposure done safely and progressively. Number 3 is daily singing or vocal practice. Number 4 is brief yoga or mobility that focuses on breath. Daily paced breathing wins because it's the most evidence-based and easiest to maintain. Cold exposure is powerful for building resilience, but it has a steeper tolerance curve. Singing and movement are excellent supportive practices, and they help with mood as well as physiology. Now, let me compare fast resets to long-term routines. Fast resets are excellent when you're in the middle of an acute spike. They're tools you can use in the moment. Long-term routines are the insurance policy that make those spikes less frequent and less intense. In my testing, the fastest relief in the moment is the modified Valsalva. It is the single quickest way to change heart rate. The most practical fast reset for everyday life is paced breathing. For long-term benefit, the most consistent winner is daily slow breathing practice. Here are practical takeaways you can use. If you need immediate relief, try the 4-breath box first, since it's safe and portable. If you need a stronger physiological reset and you do not have cardiovascular problems, try the modified Valsalva with caution and professional guidance. If you want a reliable tool to use anywhere, add humming or singing to your breathing practice. For long-term resilience, practice slow breathing for 10 minutes every day. If you want to nudge resilience further, add regular cold exposure and a short daily movement routine. A final reminder is that these practices are tools and not replacements for therapy or medication when needed. If anxiety is frequent, intense, or stopping you from living the life you want, please talk to a healthcare professional. If you want to start simply, here's a 1-week plan. Do 2 minutes of the 4-breath box twice a day. Do 10 minutes of paced breathing once a day. Add a 30-second cold neck compress when you feel tense. Track how you feel and adjust. Thank you for watching. If you try any of these routines, tell me which one you noticed first and which one changed your baseline after a week. If you want me to test more routines or do a longer follow-up, I am happy to. Subscribe for more science-informed, practical nervous system tools, and I will see you in the next video.